Hello, I'm John Miller, Tacoma Community College. This is a test review for Unit 4 for Nursing 211, and I'm flying above Evergreen. You can see a sphere rotating which has some of the different lobes of the brain. We're going to kind of fly down where the slides are, and these of course are available on Google Docs, and the link is in Google Sites that we have for the course. As far as assessment for various neurological problems, I think it's more helpful to sort of lump them all together. There are many similarities and a few differences. Assessment for TIAs, CVAs, trauma, neurosurgery, and increased intracranial pressure. So we have one of the assessments that's really important is the decreased level of consciousness or changes in level of consciousness, which is one of the early signs of increased intracranial pressure. And sometimes we need to use painful stimuli to get any sort of a level of consciousness information. And all of this is, of course, on the Glasgow Coma Scale. There are early signs, there are middle signs, which include some respiratory patterns as well as pupillary signs. And there are late signs, which include some other respiratory patterns, especially the ones that have less breathing involved, and of course Cushing's triad, which involves the blood pressure, the pulse, and the pulse pressure. Lab tests are often ordered for people with neurological problems. One of the tests is usually ordered is a blood glucose, and this may also of course be done at the bedside just to make sure that a low glucose is not causing, or a high glucose in some cases, is not causing the the decreased level of consciousness. Left versus right brain injuries, and you need to know the differences of those, and they're in the presentations on Google Sites. The dominant side of the brain, which one's the dominant, you need to be able to differentiate between the different types of CVAs, which include thrombotic, embolic, and hemorrhagic. Need to be able to identify information about assessing someone's eating ability, assessing their aphasia, amount of aphasia, amount of dysarthria, the presence of homonymous hemianopsia, and presence of some other neurological assessments such as apraxia, unilateral neglect, and finally you need to be able to assess for a medical problem diabetes insipidus, where there's a large amount of urine coming out because of a neurological problem and not enough antidiuretic hormone. Treatments for CVA, TIA, trauma, neurosurgery, increase intracranial pressure. Again, left versus right brain injury, especially in terms of nursing care, in terms of rehab. The three different types of CVA, how they differ, and I spoke about those in the last slide. Eating, contracture prevention, hyperthermia, confusion, aphasia, dysarthria, vision including homonymous hemianopsia, apraxia, unilateral neglect, and diabetes insipidus. So kind of the same things that were on the previous slide, except this time it's treatment. Also, let's go over here, and there's some various medications that are pretty important for this particular unit, and I've listed them here, and we'll look at a slide here of some of the medications. So some of the medications include mannitol, dexamethasone, phenytoin, diazepam, Ativan, carbamazepine, valproic acid, phenobarbital, and nimopridine. And those are quite similar to the ones that are on this box over here. So you need to know the therapeutic effect, how they're administered, and any adverse reactions. The treatments to most be concerned about most for this particular exam. Drug administration rates and calculations, special procedures, positioning and other treatments to decrease intracranial pressure. As I said already, treatments for different types of strokes, dysphagia treatment, contracture, prevention, treatments for generalized tonic-clonic seizures, diabetes insipidus, prevention of confusion, how you would do that and how you would treat somebody with confusion, and then basilar skull fractures and status epilepticus. You walk around the other side here. Here are the assessments again on a pretty much everything I've talked about on the slides. And if we go to the last couple of slides here, actually we're going to go back one because there was something about seizures. In terms of the seizures, the specific types of seizures, what's specific about assessment about status epilepticus, and then general assessments for anyone who has seizures. Treatments for generalized tonic-clonic seizure, formerly known as a grand mal, the medications and other interventions, treatment for status epilepticus, and then finally discharge and long-term issues for epilepsy. In terms of trauma, assessment and treatment of these problems: concussion, basilar skull fracture, epidural hematoma, subdural hematoma, and contrecoup injury. So that's kind of the slide. So let's walk around a little bit more and look at some of the displays that I have out here. See if you can recognize what this is without even having a title, a description. So what you see here is a large hematoma on the right side of the picture, and that's pressing the midline structures, and it's causing a shift. So the entire brain is pushing to the other side, which I'm assuming is the patient's right side. So the hematoma is on their left and it pushes over, unless we're in the back, but I'm not sure. So you get some pressure, and this is actually a herniation picture. So it's showing downward BZAT, showing pushing herniation that would be quickly lethal, which is going down towards the brainstem. A, which is right up in this area, is showing it's herniating over, shifting over to the other hemisphere. And D is actually pushing out through like an open skull fracture. And C is pushing again down towards the brainstem from above. So you have some different syndromes with herniation. And our goal, of course, is to not even have a patient close to herniation, but to pick up their assessment, especially their level of consciousness, which is an early sign before all this stuff can happen. This is an interesting picture, an aneurysm, where aneurysms can occur. And of course they can occur anywhere. A subdural hematoma, just a visual representation of that. This one is basically some anatomy. Let's walk over here. This is where a bone flat's been removed for like a hematoma, an epidural or a subdural hematoma, and then the bone flap's put back, or sometimes they'll put some synthetic substance in there to sort of close up the skull. And some people, of course, will have wear helmets, because if they don't have the bone flap in, it's very dangerous, and any pressure on the brain could be lethal. This is a picture from a legal website, and it's showing actually putting in a shunt, not a shunt, but a intracranial pressure monitor. A shunt is quite similar, except it has a catheter coming out of it and usually stays in the patient and drains the fluid. A catheter, of course, attaches to electrodes. It has some kind of special bag attached under pressure that delivers just the tiniest amount of fluid to keep it clear. You can see the catheter. On this particular picture, you can see where it goes into the skull and just barely on the edge of the brain. So, and of course, the risk with intracranial pressure monitoring is the risk of infection and meningitis. Here are some different areas of the brain: Broca's area and Wernicke's and other places, the visual cortex in the back, and so forth. This particular image on the right is showing a area of there's injury, and this is after the rupture, so like a cerebral bleed. And this diagram is quite similar, but it's just showing that there's some weakened blood vessels or diseased ones. And this one's a little bit hard to see unless you're in Second Life, but you have various things that are different lobes, and this is the frontal area, so you have organization, decision making, and so forth, judgment all up front there, and you have the language area, speech in this particular area, consciousness down here, more in the midbrain area, I believe. So anyway, it's kind of an interesting diagram of some of the functional areas. There's a quiz here. You can take it if you just click on it. I'm going to click on it once. It'll turn it off because I own the thing, but I'll click on it and click it back on. So if you click on it, over on the left it says 3 days following intracranial surgery, a client develops fever, nuchal rigidity, and headache. The nurse would suspect a what? Meningitis was the answer. So if you click on this, you can actually win some money. And some of the questions are rather long, but I think it's kind of interesting to take a look at. Last thing I wanted to show you was this model, and this is designed to be intracranial pressure. So if you think of this box, shoot from down above, the box is actually your brain, and it's confined space. And so if we put all these, I'm right clicking and dragging these, and you should be able to drag these around. So inside the box we have cerebrospinal fluid, which is one of the components. We have the edema in the neurons, and then finally the red one we have mean arterial pressure. So basically, as one of these increases, so a cerebral bleed, you would have increase in the blood flow and so forth. One of the other ones has to decrease. Or if you have too much edema, say from trauma, again one of these has to decrease. And so you're going to have to move one of those out. And so that's what's the question at your top. What happens if mean arterial pressure, cerebrospinal fluid, and cell edema increase within the skull? And of course you have increased intracranial pressure. So you can right click on these and drag these out. There's not too much else to it, but it's a visual representation of the brain. So, and that concludes our review for Unit 4, Nursing 211. And please let me know if you have any questions. Thanks. Bye.